What about health? It took just that one question to make me rethink everything I've done for years. Ben had worked somewhere where they'd always used health impact assessments for making decisions, and he found it frustrating that HIAs weren't compulsory here. He explained that HIAs don't just look for the negative health risks, they look at ways decisions can positively improve the health and well-being of a community. He identified simple changes that would mean the whole community could benefit health-wise. Little changes that wouldn't cost the earth, but could make a huge impact. Even simple considerations in the actual construction stage could have an enormous health benefit. He reminded me that an employed community is a healthier one, and this resonated with me. Considering health in any new project should be a priority. So, I challenged my boss about it, but he said no. He understood how beneficial it could be, but it wasn't a priority. Said he was nervous of having another box to tick. So I was really pleased to hear about the British Medical Association Cymru Wales' campaign.
BMA Cymru Wales is calling on the Welsh Government and the National Assembly for Wales to take forward world-leading legislation to make health impact assessments meaningful and mandatory. Health should always be a consideration, and prioritising health should not be a choice. And done properly, HIAs have the power and scope to identify opportunities for health improvement and fill gaps in service provision or delivery in a range of circumstances. They go beyond identifying risks, and they don't need to be burdensome either. A simple screening tool followed by an assessment incorporated within existing processes would make a huge difference to the well-being of all communities in Wales, especially vulnerable groups. HIAs need to be mandatory, and the recommendations they produce must be acted upon. We call upon everyone to ask, what about health?